Hello, my name is Pedro. I am with Unified Care Services, and we're going to be talking about the Breas Vivo 45 LS ventilator. The Breas Vivo 45 LS ventilator weighs approximately 5.3 pounds. It has approximately 9 hours of battery life. There are 2 batteries in the Breas. One of them is a detachable battery, and it's on this particular side over here. In order to access the battery, you have to press these 2 buttons, remove this here panel door. The battery is located at the very bottom here, so if you press on that, you can actually remove the battery. Now, the battery also has an indicator here where if you press it, it can tell you how much battery life you have. Now, above the battery sits what's called the humidifier bypass, and this has to be all the way inside to the point where you hear it click. If it's not pressed all the way inside, you're going to get an alarm when it's actually in use, and the alarm will say humidifier bypass, and it's always going to be that this has come loose, and all you have to do is push it in to silence that alarm. To put the door back in, you simply present it and get it to click. On the other side of this ventilator, you have another door, and you have 2 filters here. You have a white disposable filter. This filter, you should change it on the average of at least once a month. If the environment is particularly dusty, you might want to consider changing this filter every 2 weeks. So if you're first starting to use it in your home, check it in 2 weeks and see if it's dirty. If it is, then replace it. If not, replace it once a month. So replace this filter, do not wash it. The other filter, you're simply going to wash and you get all the dust off of it, dry it, and put it back. When you're putting it back on, the white disposable fine particle filter always goes first toward the machine, just like this. Okay, so then you take your door, you present it, you get the clips in the bottom to line up, press it in, and you got it. Okay, so again, you got 6.5 hours of battery life on your detachable battery. There's also an internal battery with this particular ventilator. That's 2.5 hours approximately, and you should have about 9 hours of approximate battery life with this ventilator. So you already know about the filters on this side. Now, if you look over here, you have a fan inlet filter that basically, this is the fan that cools the motor inside the ventilator. This also has to be maintained. There's a little door here where it opens. This is also a non-disposable, reusable filter. So when you clean the filter on the other side, you're going to take this filter as well, wash it, dry it, and put it back. Get all the dust off. On the back of the ventilator, you have an area here where you're actually going to plug in the external power from the AC outlet. And when you put it in, you want it to slide in easy. So if it's not sliding in easy, you want to make sure that it does so that you don't damage anything there. This is where you're going to bleed in the oxygen from your oxygen source inside the home. And it's basically going to be an extension tube coming from an oxygen concentrator or an oxygen tank directly into the back of this bleed-in adapter. Okay, also on the back of the ventilator here, you have where you can attach 2 cables. You have the yellow end-tidal CO2 cable that will connect to an adapter where you can actually measure the CO2. And on the back here, you have a blue cable that will measure the pulse oximetry on the patient. That cable connects directly to a probe to the patient's foot or finger. All right, if you look at the very front of the ventilator here, you're going to have some lights. This top light here means that it's actually plugged in. So the wavy line means that it's plugged in. You have 2 battery indicators here. They're also lit up when the batteries are in use. The one with the little arrow pointing to the side, that's your detachable battery. That's your 6.5 hour battery source. And the one below is your internal battery, and that is 2.5 hours for a total of 9 hours approximate battery life. Okay, also this other light that's below the wavy light. The wavy light means that you're plugged into the wall, that's AC, and then the one below it is DC, direct current. So if you're out camping and you're running your ventilator off a battery or direct current source, then that light will be lit up. Up here, you have your alarm silence light. So when you silence the alarm, which you do by pushing this button here up on top, it silences the alarm for 2 minutes. You're going to have an alarm light, alarm silence light that appears right here. First off, I want to show you how to turn on the ventilator. The ventilator is right now using a battery. It's on the indicator where it has the detachable battery is lit up. So it's on battery power right now. And to turn it on, you're simply going to have to hold this button down for 3 seconds, and then it's going to start to ventilate. Once it's ventilating, you're going to see these two bars. They're going to be moving back and forth, letting you know that the ventilator is actually moving air. Right here we have an alarm setting, an alarm window where all your alarms are going to appear right here. Now this is a particular alarm. It was one beep, and it basically is telling us that the ventilator is now running on a battery. So that's good to know, because if we're home, we're coming back from the doctor's office. It's very important that we do not forget to plug the ventilator into your AC power outlet. So to clear all the alarms, you're simply going to hit the OK button. It's going to clear the alarm. All right, let's talk a little bit more about what's actually going on this part of the ventilator here. Again, I have it hooked up to a test lung, so it's simulating a patient being ventilated. And this is a very good screen to have at home. This particular screen gives you a lot of information. Not only does it show when the patient breath is being delivered, but at the same time it gives you overall respiratory rate. It gives you your tidal volume, which is the amount of air per breath that's being moved into the patient. In this particular case, it measures what's being exhaled, so it's your exhaled tidal volume. And then it tells you, as far as your leakage is concerned, how much leak you have here. And it also gives you a reading on your peak pressures and your PEEP. So it's a very informative screen, and that's what's recommended that you have on when you're using the ventilator at home. So I'm going to show you some of these buttons and what they mean. So if you hit the main button here, you're going to get this particular screen. So it's just going to activate this screen. If you like the screen, go ahead and use it. It's not as bright, maybe a better screen for at nighttime when you're asleep. Also, the machine also has 2 battery indicators here. And it not only does it give you a percentage, 96%, 100%, but it also gives you a color as well, letting you know green, yellow, red, as far as the level of charge in your battery. Obviously, green is high, yellow is just around the medium, and then red would be low. Okay, this particular battery here is the measurement of your detachable battery. You know that because it has a little arrow right there. So that's your detachable battery, which happens to be on this side. That's 6.5 hours. And this is your internal battery, which is 2.5 hours approximately, for a total of 9 hours. All right, so if we hit the button here that says setup, it's going to tell us the settings for the ventilator. This ventilator right now is set at 2 profiles. We have a primary profile, profile number 1, and a secondary profile, profile number 2. And the reason I did that was to illustrate how to toggle back between both profiles. So it could be that the doctor wants you to use profile number 2 when you're asleep, and then profile number 1 during the day when you're awake. So if that's the case, I'm going to show you how to change from one to the other. So if you highlight the profile by hitting the down button, and then hit the left button to highlight the other profile, profile 1, it's going to ask you, are you sure you want to switch over? And you're going to hit yes, and then now you're on profile 1. Whenever you have a box over a profile that's not dark, that's the profile that you're using. Also on the upper part of the screen here, you're going to have an indicator letting you know which profile is being used. So even if you're using this particular screen, it's going to tell you right up here which profile is being used. Okay, so back to the setup button. We're on profile 1. Let's just repeat that real quick. We highlight profile 1 by hitting the down button. We hit the right button to move it over to the right. It's going to prompt, are we sure we want to change to profile 2? We hit yes, and now we're using profile 2. And these are the settings that are applicable for profile 2. So it's important to actually know what your settings should be. So if you're just recently being discharged from the hospital, what I try to recommend to caregivers, parents, if it's a kid or whoever, is to take a picture of your settings and know what your settings are. We don't want somebody coming in and changing your settings without you not being aware. So if you ever want to check on your settings, you simply hit the setup button and you can verify your settings. Now let's go over to the alarm button. We're going to hit the alarm button once, and this is going to be the alarms that are programmed on your ventilator. And right now I have most of these off so as not to have any alarms disturbing the video. So the very first alarm that we have is high pressure. And a high pressure alarm basically means that the machine is not able to move the air in toward the patient. Something is blocking the air from going into the patient. And the first thing you want to do when you have a high pressure alarm, always check the patient first once you've done a quick assessment on the patient. Then you want to probably suction the patient. Typically when you have a lot of excess secretions or possibly a mucus plug, it could result in a high pressure alarm. So you suction the patient. If you're suctioning the patient and you happen to have resistance when you're trying to push in the catheter, that could be an indication of a mucus plug. So at that point, my recommendation would be to change the tracheostomy tube out as quickly as you can. Okay, so change the trach tube if you have a mucus plug. Otherwise, if you're suctioning the patient and you're able to suction out a good amount of secretions and now this alarm quits sounding, you resolve the alarm. Another possible cause for a high pressure alarm could be water in the tubing. Okay, so if you have a lot of excess water in the tubing, and typically the way that works is the tubing comes down and then back up. So you might have water accumulated at the bottom of the tubing here. If that's the case, you want to drain the water out. There's two ways you could do this. I don't recommend that you actually drain the water back into the water chamber, because if there are secretions that have moved into the circuit, then what's going to happen is you're going to contaminate that water that's in the water chamber, because you're going to move the secretions back down into the water chamber. So what you could do is you can actually detach this here, empty the water into a bucket, okay, and that's probably the best way to get rid of the water that's in the circuit. So that's your high pressure alarm. Also make sure that there's no kink in the tubing. That could also cause a high pressure alarm. We're going to go over some of the more important alarms. Again, low pressure, this is the next alarm on the list here. Low pressure basically means that you have a leak somewhere. And if you do have a leak somewhere, then the first thing you want to do is check the patient, make sure that the tracheostomy tube has not come out, that the ventilator circuit has not become detached from the tracheostomy tube. And then you want to work your way on down, make sure that there's good integrity throughout the whole circuit, from the patient to the water chamber and the water chamber to the ventilator. Okay, so that's how you troubleshoot a low pressure alarm. This ventilator has a feature, there's an eye here, which if you press it, if you highlight either a setting or an alarm setting or an actual ventilator setting, okay, if you press this button, it's going to give you a description as to what that either ventilator setting or alarm setting actually is and what it means. So it's a very nice feature that this device has. It's new technology. And if we go back to the alarms and we highlight low pressure and hit the I button, now you have a description as to what that particular alarm is, when it's activated, and what the possible causes are of that particular alarm, which is very, very nice. Okay, we're going to continue on down. My recommendation is, if you do have this ventilator at home, that you highlight each and every alarm when you have time, and then basically learn what the possible cause of that alarm is, and how to resolve that alarm. I'm not going to go over every single alarm. I will go over a few of them, but that's my recommendation. Make sure you become familiar with all your alarms, and this is a very, very good way to do it. Just highlight the alarm, and the information that you need will be right there. Okay, so high breath rate. If you get a high breath rate alarm, typically you want to look at the patient. The patient's breathing more than what they're supposed to be breathing, faster than what they're supposed to be breathing, and it could be more or less a patient-related alarm. The patient could be sick, trying to compensate by breathing faster to get more oxygen in their body. Low breath rate alarm. Also, you want to check the patient first when you get a low breath rate alarm. And depending on where the alarm is set, it could mean a couple different things. If the alarm is set just below the programmed respiratory rate setting for the ventilator, then that could mean that the ventilator is not functioning properly and it's not giving the minimum required amount of breaths that it's supposed to give. So low breath rate alarm, check the patient first, and then you want to make sure the ventilator is giving the appropriate amount of breaths that it should be giving. And if you hit the setup button, like I just did here, and you go to where it says rate, then that's the prescribed minimum amount of breaths that the patient should be receiving. So if I set the low breath rate alarm to, let's say, 18, and I'm supposed to be getting 20 breaths per minute, then I know that the ventilator is not giving what it's supposed to, the minimum amount of breaths it's supposed to be giving, so it's a ventilator problem. At that point, what I would probably do is, if you have a backup ventilator, put the patient on the backup ventilator. If you do not, I would start to bag the ventilator, and depending on the condition of the patient, if you can be without the ventilator for a while, you want to call the provider, the medical equipment company, and if not, at that point, you might want to start using the ambu bag, ventilate the patient, and call 911. Okay, let's go back. Alarms. Next alarm, we're gonna skip these two here. We're gonna talk about the apnea alarm. Apnea alarm is a spontaneous breathing alarm, meaning that, as we already learned, the machine is set to give 20 breaths per minute. If the patient doesn't breathe above 20 breaths per minute, then the machine is going to give you an apnea cessation of breath alarm. That's what apnea means, cessation of breath. So apnea alarm, you always want to check the patient first, make sure that the patient is okay. It could also mean that we do get apnea alarms at times when the patient is asleep and they're breathing really shallow. They're not triggering a breath from the ventilator. It could mean that the setting, the sensitivity setting on the ventilator might need to be adjusted by your respiratory therapist, your medical equipment provider. So that's your apnea alarm. Check your patient. Disconnection alarm is obviously something that's become disconnected. And always you want to start with the patient first, work your way over to the water chamber, and from the water chamber over to the bacteria filter. Make sure all your connections are in place. The last alarm I want to talk about is your rebreathing alarm. Your rebreathing alarm is basically a low circuit leak alarm. It means that you're not getting rid of enough exhalation. And in this particular circuit, you have an exhalation valve that's right here. And this exhalation valve, if you're using this exhalation valve, you don't want to have it in a position where it's pointed downward like this, or being onto the clothing or the bedding of the patient. You want to have it so it's either like this or like this, so that it's freely moving air out. If it's downward, it could be that the secretions have run down from the patient, and there are these little holes right here and clogged up these little holes. And now your exhalation valve is not able to get rid of enough air, and so you're going to get a rebreathing alarm. If that's the case, you need to change your exhalation valve out right away, and you should always know where these extra valves are. Okay, so that's your rebreathing alarm. Learn your alarms, highlight them, hit the I button, and become very familiar with the cause and the what the alarm means, the possible cause, and how to troubleshoot that particular alarm. So if I hit the alarm button one more time, now I'm going to get into the history of all my alarms. And as you can see here, you have your red, you have your yellow, and if I continue on down, you're going to see some white. So, of course, red is going to be your high priority alarms, yellow is going to be your medium priority, and then low priority is going to be your white. That's when you turn it off, or maybe you lose power. When you lose power is a yellow. Turn it on and off, stuff like that. So again, if you want to look at the history of your alarms, you toggle through your alarm button till you get there, and you can scroll down. Now, it's going to tell you the date and time that the alarm occurred, and it's going to tell you which alarm it was that it occurred. So you have a history of all your alarms right here. All right, so we're done with the alarms, and now we're going to move back to our monitor screen. I already went over this a little bit a while ago. This is a good screen to monitor the patient on. It gives you a lot of information, most importantly, overall rate and volume and leak and pressure. Okay? Now we're going to go over to the button that says Others over here. So once I press that button, I'm going to be able to highlight a few things. Humidity settings. This ventilator has the ability to connect a humidifier into it right over here. And that's for non-invasive patients that are wearing, let's say, a nasal interface or a full face interface, and they don't want to use an external humidifier. This ventilator actually has a humidifier that will clip right in, but in this particular case, it's not applicable. Really, what you're interested here under Other is device settings. So if you highlight device settings and hit the right button, you have these particular settings that you can alter if you want. The first one is display light. You have a delayed feature on, and auto. The auto feature uses the sensor that's right up here to determine how much light is in the room, and it will adjust the screen accordingly to the ambient light. So right now I'm going to move it back to on, and I'm going to leave it on. Okay. The one below it is light intensity, and if you want to decrease the intensity of the light on the screen, this is where you do that. The other two are the alarm keypad lock. You should probably leave that off. And the home language, which is going to be whatever home language you choose for the ventilator. The ventilator right now is in the home mode. The reason you can tell is because you also have a little lock that's appeared up on the left-hand part of the screen up here. And if you highlight a setting, then you can't change it. There's no way to change that setting, so it prevents somebody from coming in and changing the settings. So at this time, I also want to mention that you have an alarm silence button, which I think I already did, but it's right up here. So if you're troubleshooting an alarm, you want to hit the alarm silence button, especially at nighttime if you have other people that are sleeping, you don't want to disturb them. Just hit the alarm silence button. It will silence the alarm for 2 minutes. And at that point, you can troubleshoot the alarm without having that audible alarm sounding. Some high priority alarms, you might not be able to silence it for the 2 minutes, but it's going to continue to alarm during some particularly high priority alarms. Okay, so to turn on the humidifier, you simply hit the on button on the bottom right hand side of the humidifier, and it turns it on. And the humidifier will now go up in temperature. Always make sure you have plenty of water in your water chamber. Either sterile water. If you don't have any sterile water, distilled water is the next best thing to use. So it's always good to have a couple gallons of distilled water on hand. Now, you don't always get enough sterile water from your provider to keep this full, along with other uses that you would have for your sterile water. All right, so we turned it on. It's going to go up in temperature. The temperature on the humidifier is going to typically fluctuate between 35.5 and possibly go up to even as high as 39 degrees. But the average temperature should be right around 37. All right, troubleshooting the humidifier. If you get an alarm, the first thing you want to do is make sure you have plenty of water in the water chamber. And what I mean by that, you don't just want to have a couple of centimeters on the bottom. You want to have it at least halfway full or just underneath the full mark. So if your water chamber is full, then the next thing you want to do with the humidifier is you want to turn it off. Right now it is off, but just to illustrate, turning it on is this button here, okay, and then turning it back off is right here. So you turn it off, And then the next thing you want to do is you want to remove the heater wire cable and put it back. You want to remove the temperature probe cable and put it back. And by the way, when you're putting these in, make sure that they slide in easy. If it doesn't slide in easy, don't force it. We've had a lot of people break these cables this way. Just slide it till you get to the point where it slides in easy. And then after you removed and put those two back, you want to come over here and you want to detach the top of the heater wire cable, which has 3 prong things. And you want to line it back up and make sure it goes all the way back in. And then you want to take the temperature probe out. You want to clean it with alcohol, and you do this every single time you remove the temperature probe from the circuit. Clean it with alcohol, carefully align it, and push it back in until it snaps. And that was a good example of an alarm right there. It tells you what the alarm was right here. It was a disconnection alarm, and something had become disconnected, so it let you know. And again, the device will only alarm for the duration of the problem. As soon as I put it back in, the problem was resolved. The machine ceased to alarm, but the alarm message remained here for us to see what had happened. And once we hit OK, we can clear our alarm. So again, troubleshooting the MRA50, you turn it off, pull it out, put it in, pull it out, pull it in, bring this out, clean it with alcohol, put it back in, and the same thing on the proximal side of to the patient of the temperature probe. You take that out, you clean it, and you carefully put it back in. And then you turn it back on. Okay, if that doesn't resolve your alarm with your humidifier, then you have no other recourse but to call the medical equipment company and have them come out. And it could be one of these cables has gone bad. It could be that the actual humidifier has gone bad. Now, one thing you might want to note is that if you just happen to change the circuit, because typically these circuits with the pediatrics, we do mostly pediatrics, these circuits are changed on a weekly basis. So let's say you just change your circuit and now you have an alarm with the humidifier. Well, most likely it's the circuit. The circuit has a heated wire that runs through it, or a wire that runs through it, and that wire sometimes can go bad, even if it's straight from the factory. So if that happens, then change the circuit and try it again. If that doesn't work, then call the medical equipment provider. Okay, so that's how you troubleshoot the humidifier. These circuits, as I said, are designed to be changed on a weekly basis, especially for kids. I mean, sometimes your insurance company will only give you 2 circuits a month. If that's the case, then you change it every 2 weeks. So if you're going to change a circuit and the patient cannot be off the circuit for a very long time, then we recommend that you have somebody on a standby next to the patient with a ambu bag ready to ambu the patient, to ventilate the patient while the other person changes the circuit. But typically this should only take about 15 seconds tops to change a circuit. So if you're going to change a circuit, this is the first part that you'd want to change. You pull this off of the bacteria filter, you pull it off of here, and you replace this part. Okay, so now we're ready to change this part of the circuit. So if you want to change this part of the circuit, you got to make sure that it's free from any encumbrance. It's free, it's not attached to the humidifier, and then the heater wire cable has also been detached. Now we can change it. So you get the new part of this circuit out, you have it ready to go. And then what you probably should do, again, if the patient cannot be off the ventilator for very long, have somebody stand by with an ambu bag. If the patient can be off for a minute or so, then it's very easy to do. You just basically disconnect this part of the circuit from the patient, disconnect this part here, and then bring the new circuit, reconnect it to here, and then reconnect it back to the patient. And that way, you're basically without being ventilated, the patient's without being ventilated for a short period of time, probably 5 seconds at the most. Once you've done that, you're going to remove the temperature probe cable from the old circuit and you're going to reinsert it into the new circuit. And again, do not forget to wipe down the temperature probes with alcohol, before you insert them back into the new circuit. And then you're going to reattach all the rest of your connections, just like this. Going to come over here, put that all the way in, and you're going to turn on the humidifier. Please don't forget to turn on the humidifier. If you're coming back from a doctor's appointment and your patient or the person who's using the ventilator has an HME in line, please do not forget to remove the HME before you reattach the circuit with the humidifier in place. It's happened several times. I've received calls, caregivers telling me, why is my baby desaturating? We just got back from the doctor's office. We put him on the humidifier. And then I ask them, did you leave the HME in place? And they say yes. So I just have them remove the HME. So don't forget to remove the HME once you put your patient back on the circuit. And that's how you troubleshoot the MR850 heated humidifier. At this time, I want to thank you for joining me on my video presentation on the Breas Vivo 45LS ventilator. I hope you've maybe learned something new. And thank you for joining. Thank you.